Welcome back. We continue our COVID-19 coverage tonight. And from one estimate to another, it is clear there are different opinions on when it is safe to lift those stay-at-home mandates. Two doctors are getting a lot of heat on social media for claiming that Kern County should open immediately.
As I shelter in place, my immune system drops. You keep me there for months, it drops more.
Doctors Dan Erickson and Artin Masihi say sheltering in place is doing more harm than good. They're the owners of Kern's largest testing site, Accelerated Urgent Care. They say as long as you're not showing symptoms, you should be able to return to work and kids should be able to go back to school. They claim the death rate has remained consistently low, similar to the flu. But their numbers don't agree with statistics from the Centers for Disease Control and Prevention. 34,200 people died from the flu during the 2018-2019 season. That is a death rate of 0.01%. So far, more than 46,000 people have died from the new coronavirus. That's a death rate of 5.6%.
The secondary effects, the child abuse, alcoholism, loss of revenue, all these are, in our opinion, a significantly more detrimental thing to society than a virus that has proven similar in nature to the seasonal flu we have every year. We need to still shelter in place. Our answer is emphatically no. Do we need businesses to be shut down? Emphatically no.
And it is important to note that the doctor's claims are based on data from the past 2 months and not long-term scientific studies.
Well, today, Kern Public Health said flat out that it disagrees with the doctor's opinions you just heard there. And we're also hearing from other local doctors who dispute that message. 17's Eitan Wallace is joining us now with that part of our coverage.
Yeah, two doctors we heard from today did not mention Dr. Erickson by name, but they definitely offered a different message.
This virus is not a virus to be taken very lightly.
On Facebook Live Thursday, longtime Kern County infectious disease doctor Naveen Amin shared his expertise on COVID-19.
It is a killer virus. It is a virus which spreads very rapidly, and it doesn't spare anybody.
Interviewed by his daughter Namisha Amin, also a medical doctor, the senior Amin was emphatic.
Even an asymptomatic person, 25% of them, can spread this virus without knowing it. As a result of that, this social isolation has become a very big help.
25% of individuals may in fact be infected with COVID-19, but be completely asymptomatic.
That is correct. That they will be entirely asymptomatic, they may not even know that they are harboring the virus, and yet they can spread the virus.
And so that's why we need everyone to practice social distancing.
As for Dr. Dan Erickson's claims that sheltering in place could lead to weakened immune systems, Dr. Amin says that is not the case.
Social isolation has no bearing or has no effect on the immune system at all.
On Dr. Erickson's claim that this virus so far has proven similar in nature to the seasonal flu, Dr. Hemel Kothri on Sunrise Thursday morning shared otherwise.
Is it fair to say that this is comparable to the seasonal flu?
As of right now, I would say absolutely not. We have seen the flu acts a lot different. This virus is a lot more virulent. It passes from people to people a lot more aggressively. The symptoms a lot more aggressive, and it seems to be affecting a lot of other age groups, which the flu typically won't affect.
As for testing, Dr. Amin is calling for more widespread FDA-approved testing beyond just those with symptoms.
We may be missing a lot of people who are entirely asymptomatic and spreading the virus.
And going forward, Amin shared what could happen if society reopens too soon.
There's no doubt in my mind that if we abruptly remove all the restrictions we have been putting at present, which has helped us a lot in trying to prevent the spread of the virus, it will definitely flare up, increasing number of cases as well as deaths.
Dr. Amin also offered advice. He says listen to the CDC and other experienced infectious disease doctors like Dr. Anthony Fauci. Now, if you would like to listen to the full 30-minute interview of Dr. Amin, we have posted that on our website, kget.com. In Northwest Bakersfield, Eitan Wallace, 17 News.
Thank you, Eitan. And that is the subject of tonight's 17 interactive feedback poll. We've been asking you, do you agree with Dr. Erickson's ideas that people in Kern County should return to work and school immediately? Over 3,700 of you voting so far in tonight's poll. 41% of you agree with Dr. Erickson's idea that people should return to work and school immediately. 59% of you disagree with that perspective. Here's a look at some of your comments. Susan Sterner says, I agree with the doctors. The numbers do not justify the panic. If one is immune compromised, then they should remain in lockdown. And Yina Alvarez says, I don't care what he says. If there's a virus out there and there is no medication for it, and I am not an essential worker, I'm staying home, and my family too. All material things can be replaced, but not a life.